Hello. So in this video, we're going to discuss why hydration matters. This will be your guide to staying hydrated before and after bariatric surgery. So grab a drink and let's get ready. There are so many benefits to staying hydrated. Now, this is for everyone, not just people who have had or thinking about bariatric surgery, but hydration helps you to regulate your body temperature. It keeps your joints lubricated. It improves sleep and your mood. It delivers nutrients to all of your cells, and it helps to keep all of your internal organs functioning properly. After bariatric surgery, hydration is your #1 goal. It is especially important after surgery to stay hydrated. 1, it prevents dehydration. It assists in healing. It aids in digestion, prevents constipation. It prevents kidney stones, and it will help boost your energy. So before we talk about surgery, let's talk about the pre-op diet and your fluid goals while you're on your 2-week pre-op diet. The 2 weeks before surgery, you will be on your pre-op diet. You should ensure that at this time, the 2 weeks before your surgery, you are getting 64 to 80 ounces of fluid. All the fluids should be caffeine-free, non-carbonated, and sugar-free. And if you look at the nutritional label on the back of your drink, you should ensure that it's 5 calories or less per 8-ounce serving. If you have any questions, refer to page 4 of your green pre-op diet papers for any examples of things you can drink. Some examples that you can have, it's not limited to this list, but great list to go off of would be water, Crystal Light sugar-free packets, Gatorade Zero, Hint Water, Mio Liquid Enhancer, Propel, Powerade Zero, sugar-free Kool-Aid. You can check out the Vitamin Water Zeros. You can even have sugar-free Jell-O, but make sure it's the clear. I'm not talking about pudding, I'm talking about clear Jell-O. You can have fat-free chicken broth, and you can have fat-free popsicles. Now, the day before your surgery is clear liquids only. And what I mean is you have to be able to see through that. No food, no protein shakes the day before surgery. You should be pushing to get your 64 to 84 ounces of fluid. Again, clear liquid only, no protein shakes, no food. Try to get a couple electrolyte drinks in you, and that will help you stay hydrated going into surgery. So things such as Gatorade Zero, Propel, Powerade Zero, even fat-free chicken broth has electrolytes in it. Then after midnight, so the night before your surgery, after midnight, nothing by mouth. That means no food, no drink, no medications by mouth the morning of your surgery. All right, so once you have surgery, your bariatric team will be in the hospital. They'll be rounding on you, and they will start you on fluids when they feel you are ready. It is extremely important that you remind yourself and set a goal that every day fluids is your #1 goal. You should be getting 48 to 64 ounces of fluid every day after surgery. All fluids should be caffeine-free, non-carbonated, and sugar-free. That's 5 calories or less per 8-ounce serving for life. If you refer to your blue packet, your post-op diet papers, page 4 will give you lots of examples of what you can have, but on the next slide we'll review those as well. Some examples that you can have, of course, you can have water, sugar-free Crystal Light, Gatorade Zero, Hint Water, Mio, Propel, Powerade Zero, sugar-free Kool-Aid, vitamin water, sugar-free Jello, remember that's the clear Jello, fat-free chicken broth, sugar-free popsicles, and after surgery, you can have protein waters. One example is Protein 2O. There's other protein waters out there, but it's an excellent source because not only does it count towards your hydration, but protein waters get to count towards your protein goal as well. I cannot stress enough how important hydration is after surgery. Remember, this is going to keep you hydrated. It's going to help with your healing. It is your #1 goal. You must reach your fluid goal before moving on to your protein shakes. So just some tips. You want to drink fluids frequently throughout the day. You want to get up early and start early, and you want to drink all day. Your goal is of at least 48 to 64 ounces of clear liquids daily. 12 to 16 ounces should be electrolyte drinks after surgery. That will help keep you hydrated. Using the small medicine cups will help you sip your liquids and help you keep track of how many ounces you've had per day. Your goal should be 1 ounce every 10 to 15 minutes. And a really good tip is set a timer on your phone. Use that timer, set it for every 15 minutes. That will remind yourself to get at least 1 ounce every 15 minutes. But remember, small, slow sips after surgery. After surgery, you're going to be asked to track the number of ounces of fluid that you've had a day. You'll be given a tracking sheet, maybe something like I show here on the slide, or it might look a little differently. Or some people choose to use their phone and use an app such as bariatric to keep track of their fluids. But however you decide to track your fluids, we need you to keep up with how many ounces of fluids have you had each day. The Monday or right around 1 week after surgery, you'll get a phone call from either the nurse or a dietitian, and they will be asking you how many ounces of fluids have you had each day. Tracking your fluids will be easy for you to answer that question. If after surgery you're having difficulty reaching your fluid goal, please reach out to the office. The number is 513-682-6980. We would rather you call, let us know you're struggling, so that we can help you. Sometimes it's just little tips and tricks that we need to help you with. Sometimes it's just setting a timer on your phone or sleeping a little bit less, but we'll be able to help you. So give the office a call as soon as you realize you're not reaching your fluid goal. If it's after hours or on the weekend, please still call the above number. Listen to the message. There will be an on-call number that you can reach the on-call physician. I appreciate you watching the video. And some other videos that you might want to check out are the pre-op diet, the post-op diet, and just get ready for surgery. Good luck.